Dr. David Tam is president and CEO of BB Healthcare along the Delaware coast. He's helping turn some restaurants into testing centers. Joins us now. Dr. Tam, it's good to see you. Thank you for being here.
Thank you, Scott.
What's going on down there? What are you seeing?
Well, we're seeing an increase in the positivity percentage of people with COVID-19. So that's out of 100 people, a certain percentage of people are positive, and that percentage rate is going up. So it's simply not just because we're doing more tests.
That suggests spread is what you're saying.
Yes, that is true.
And given your role in the healthcare system there, how is the healthcare system dealing with this?
Well, the healthcare system has done a great job of managing the initial surge, which we really peaked at the end of April, the beginning of May. We've been in what we call the recovery phase. As you know, hospitals around the country have suffered as a result of not getting the business that we need to do to take care of patients. So we are in the financial recovery phase, but we're also taking care of patients that had to wait for their procedures and surgeries for 2 months till we got to this point in early June where we were opening. And so what we are doing right now in the hospital and health system is taking care of those patients. But we also recognize that as the summer turns warmer and as people get out and enjoy the sunshine and the very beautiful amenities here in Sussex County, that this percentage is going up. And we want to keep the curve flat, Scott, which is why we have partnered with the Delaware Restaurant Association to do as much testing as possible, starting with the restaurant industry.
It's a very interesting idea. Take me through that. How's it working? We're literally talking about restaurants or bars that have been closed down now being used and approved as testing sites.
Well, so you heard about, I know you just talked to Steve Montgomery, good friend of mine. And as a result of what happened last week, we've been in contact with multiple restaurants and the Delaware Restaurant Association as how BB Healthcare can help them with more testing. And so on Monday, after 1 day of preparation, we started testing people at one of our restaurants, but brought in everybody in the restaurant industry. We'll do another testing site on Wednesday. Now, the focus is to make sure that we test as many restaurant employees as possible. As Steve shared with you, the employees are young, they're usually asymptomatic, and we want to get as many people tested so we know the baseline of who's infected and who's not. The ones that are infected then are quarantined and treated as much as we need to. And then what we'll do is develop a surveillance process, Scott, because we need to keep an eye on them as we go through the rest of the summer to make sure that they are safe and that the population as well as the employees in the restaurants are taken care of.
Do you have the manpower, so to speak, to do the contact tracing that you need to have done in the surveillance program that you just outlined?
Well, there's a difference, I think, between the surveillance program and the contact tracing, and you're absolutely right about that, Scott. When I say surveillance, I mean that when you test everybody that you can, you then need to follow that up periodically with some sampling size of people to make sure that the number of positives in those communities are not going up. That would be the early warning indicator that that restaurant or that owner or that industry needs to do something to take a look. Is it something to do with maybe a slippage of mask wearing or physical distancing or something to that extent? The tracking that you're calling, the tracing is a little bit different. That's where the Division of Public Health gets these positive results and then goes out and talks to everybody who's been positive as to who else they were with. Were they at a party? Were they in a group home or something like that? And then they follow up with testing those people. So when I say surveillance, I'm talking about an industry-specific approach to making sure the employees are as safe as possible.